Do you have hair loss or are you just shedding hair? Do you even know the difference? Today we are going to make it clear right here, right now. So hello everyone, welcome to my channel once again. I'm Dr. Paramjeet and you're watching Doctor Education. As you know, I make videos about health and healthcare topics, and today I'm going to differentiate hair loss and hair shedding. So let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So if you have been noticing more hairs on your pillows or hairbrush than normal, and you may worry that you have hair loss, but you could actually just be shedding more hair than normal. Yes, there is a difference. And the biggest difference is of treatment. Hair shedding stops on its own and it does not require treatment. It's normal to shed 50 to 100 hairs per day. When a body sheds significant more amount of hairs every day, a person has excessive hair shedding. The medical term for this condition, excessive hair shedding, is telogen effluvium. No, it's not a magic word from Harry Potter movie. It is a medical term, telogen effluvium. Yes, this is excessive hair shedding, and it is very common in most people. You can have this problem if you have lost a lot of weight recently, more than like 20 pounds, 8, 10, 20 kilograms. Doesn't matter how fast, but if you have lost weight, you will shed hair also. That will happen after a period of months, some months, 1, 2, 3 months. Then if you have given birth recently, then you will lose some hair because of estrogen drop. There will be drop of estrogen hormone levels in your body, and that's why you'll lose hairs. And if you're experiencing a lot of stress, if someone has died, someone had a divorce, or losing a job, a big contract, a breakup, so that all stress can actually lead to hair shedding. If you have a high-grade fever, if you have undergone a recent surgery, recovering from an illness, if you had a high fever, or if you have stopped taking birth control pills, all these things can actually stimulate increased amount of hair shedding, and they do not need treatment. Most people notice the excessive hair shedding a few months after the stressful event. For example, a new mom can see excessive hair shedding about 2 months after giving birth. The shedding usually peaks about 4 months after that, and then the shedding becomes low, and the shedding decreases gradually and stops, and the hair recovers. And this shedding is normal. It is normal, it is temporary, it does not need treatment. So if you have any of these conditions, don't go around experimenting on your hairs. This is because your body readjusts. As your body readjusts from the stressful situation, your excessive shedding stops. Within 6 to 9 months, the hair tends to regain its normal fullness. Yes. If the stressor stays with you, that's a different condition. So in that case, hair shedding can be long-lived. So it can continue. So people who are constantly under a lot of stress can have long-term excessive hair shedding. In that case also, treatment is required for the stress, not hair shedding. So hair shedding, telogen effluvium, is not abnormal, it's normal shedding. It does not require treatment. So what is hair loss? Hair loss is different from hair shedding, and hair loss occurs when something stops the hair from growing. The medical term of this condition is anagen effluvium. Another term. So anagen effluvium is the term for hair loss, So let's see, why would you actually lose hair? The most commonly people lose hair because of hereditary hair loss. If your family has generations of hair loss, you will lose hair. That's inevitable. Obviously, if you care more, you might lose it later. You can delay the process, but it will happen. Immune system. If your immune system is overactive and it's damaging your hairs, autoimmune disease, then you might have alopecia areata. Then some drugs, some treatments, some types of hairstyles where you pull on the hairs, like in 6, and we have that, and we have this kind of traction alopecia. Then harsh hair care products, harsh brushing, more than 100 times if you brush your hairs, you might have that, losing hairs. Then might have compulsion to pull out one's hair, that is a kind of psychological disorder. So all these things can lead to hair loss. Anagen effluvium, that's a different condition than tenogen. Then telogen effluvium, which is hair shedding, and this condition, hair loss, requires treatment. So if you have hair loss, your hair will not grow until the cause stops. For example, people who are undergoing chemotherapy and radiation therapy, they lose a lot of hairs. They might go bald, and when the treatment stops, their hairs tend to regrow. It happens. So if you suspect that a treatment or a drug is causing this hair loss which you're having, talk to your doctor. Serious side effects can occur if you just stop the medicine on your own. Remember that. Then all the other causes of hair loss may require treatment. Many people who have hereditary hair loss continue to lose their hairs with or without treatment. A woman who inherits the genes for hereditary hair loss may notice gradual thinning. Men who have these genes tend to develop a receding hairline and a bald patch that becomes in the center of the skull. The treatment of these conditions will help these people who have a hair loss, but the treatment does not help everyone. Remember that. A dermatologist is the best doctor in this case. Dermatologist, a skin specialist, is a specialist for skin, hair and nails. Go to them, let them investigate you and diagnose what all factors are responsible for your hair loss or hair shedding, and then give you a proper plan of action. So if you're concerned about the amount of hair falling out, you don't need to suffer in silence. You can turn for help to a dermatologist. Effective treatment options are available for many types of hair loss, and the sooner the treatment begins, the better is the prognosis, the better is the result, right? In my last video, I've explained the treatment in utter details. Go back and watch that video again, and don't forget to subscribe and hit the bell icon. Keep watching, keep subscribing and sharing my videos. I'm Dr. Paramjeet. I'm not a dermatologist. I'm a physician and cardiologist. I just simplify medical terminology and medical guidelines for you so that you can understand. And this channel is our channel. You need to promote it, as do I. So see you tomorrow. Till that time, take good care of yourself. Stay connected. Stay healthy.